Thank you so much for joining us today, Dr. Palmay. We really appreciate your time.
Thank you so much for having me.
So, just to introduce Dr. Palmay, Dr. Christine Palmay runs a very busy family medical practice in Toronto, where she is dedicated to offering comprehensive medical care, particularly emphasizing preventative medicine and women's health. Recognized multiple times as one of Now Magazine's best doctors, she also received the 2016 National Reproductive Health Award from the Federation of Medical Women of Canada. Dr. Palmay remains a very strong advocate for very important issues like immunization and contraception. So thank you again, Dr. Palmay.
Such an important topic that we're going to be discussing. So I am just excited to speak to you, Jenny.
Thank you so much. And to start things off, my first question is, as somebody who is such a strong advocate for HPV vaccination, I'm wondering what you see as the role of family medicine in the prevention and management of HPV-related diseases.
So, I think that's an excellent question with a very complex response. So, family practice traditionally, um, was the place where people went exclusively for immunizations. The whole concept of virtual care didn't exist. That has since transformed, and that traditional model no longer exists. So when I speak about family medicine, I sort of put myself as part of a primary care initiative, including now pharmacists, including nurse practitioners. So, I think I play a role from the perspective as being likely the first encounter our patients will have to access any other healthcare provider. You're seeing people through stages of their life. You are likely seeing patients more regularly than some specialists are. And I certainly think now, when not everybody has a primary care provider that they're tied to, it's just important to emphasize the role of preventative medicine, not just immunizations, but things like PAPs, mammograms, colorectal cancer screening, and just ensure that people are being proactive about their health. The way I frame it is that during COVID, we had no opportunities to think ahead. We were catching up. You were running behind and catching up. We were only able to be reactive. And I hope that going forward, we have learned our lesson that so much of life is not guaranteed. But if you can make a few good choices, such as immunizations, making sure your other screening measures, such as PAPs, as I mentioned, colorectal cancer screening, mammograms, are up to date, that at least gives you a basis for wellness.
Definitely. And I think family medicine's so unique in that you develop such a great long-term relationship of your patients that you speak with through so many stages of their life and having the opportunity to intervene and let them know what they can do to take control of their health. I think that's so special.
And you see the whole picture, right? When I send my patients to a cardiologist, they're there for cardiology issues, the cardiac issues. If I send them to a respirologist, they're not there to discuss their mental health, their gynecological history. So I think the gift of family medicine is that you really need to be holistic in your approach. And furthermore, in many cases, I see families, I see friends. So you can imagine how a message can spread quite easily if you speak to a woman about HPV vaccination, and then you mention her husband is eligible and her husband's my patient and he can come in, etc. So I think it's certainly busy, and immunizations is not the one area that I need to focus on. I have other priorities as well, but it's a huge part of what I do on a daily basis.
Definitely. And on the topic of education is a very important aspect of family medicine. I think there's this misconception that HPV, it's a medical concern. People think of it as a concern for young women. So I'm
Correct.
wondering if there are any opportunities that we can take for patient education on letting them know that this is a problem that affects everybody, not just women.
Jenny, you just hit the nail on the head. So, unfortunately, because the first indication for HPV vaccination targeted younger women, 19 to 26, and exclusively mentioned cervical cancer, other messages and other talks about eligibility have kind of fallen by the wayside. So, we now understand that HPV vaccination is essential for both men and women. Health Canada has adhered to a 5-year-old upper age range for vaccination. And as you know, NACI, though, understands that patients' lifestyles and the phenotypes of older patients that we're seeing now are different, and they have no upper age range. So really, every person is eligible and should be advised about the HPV vaccine. I always tell a story of I have a patient who was just approaching her mid-60s, and she had recently become widowed and was dating and having new partners and having a lot of fun in Sarasota. And I think that's a wonderful, wonderful testament to how far we've come and how aging now can be done with dignity and vitality. But that means that obviously risk factors for HPV exposure, amongst other sexually transmitted infections, has changed, and the demographic has changed. So that's a very long answer to a very simple question that everybody should have a discussion about HPV vaccination with their primary care providers. Everybody is eligible. And it takes a while to I think myth bust. There was a lot of controversy around the HPV vaccines. A lot of my patients still think that they're new. They're absolutely not. But you're right, because the first message was women in cervical cancer. We have to work really hard to break that niche.
Definitely. And I think it's amazing that we can say we have a vaccine that can prevent certain types of cancers nowadays. Not something you hear every day.
Yeah, absolutely. Another clinical pearl, Jenny, is this is a vaccine against cancer. That in
Mhm.
itself is such a powerful statement. And I think we miss the mark sometimes when counseling patients. I mean, I think that is the core message. This is a vaccine to prevent cancer.
Yeah, definitely so important. And kind of on the topic of cervical cancer, which we all know has been increasing at a very alarming rate, about 3.7% per year since 2015. And it's now the fastest increasing cancer in females. And, as somebody who's such a strong advocate for women's health, I'm wondering what weaknesses you see in our current screening or vaccination program that we have in place, and what can we improve on?
It's really tragic because after 30 years of a steady decline, you're absolutely right. We're now seeing an upstroke. And just speaking to a couple of gynecological colleagues, they're now doing cancer treatments and surgeries for cervical cancer at volumes that they hadn't seen before. It's absolutely tragic. Well, I mean, I think I call COVID the plague. Whether it's correct or not, I refer to it as plague. So during the plague, we didn't have access to primary care in the same way, and screening stopped. That certainly made a difference. And I've certainly seen a lot of patients, even though my office was open, they were trepidatious to come in and access healthcare. And it took them a while to realize that, oh my goodness, it's been 3, 4 years since I've had my PAP and my annual physical exam. So I've seen quite a number of abnormal PAPs. Thankfully, not cervical cancer per se, but I think that there's a general sense of fatigue, right? People are tired. People are sick and tired of being sick and tired. And, from my perspective, the answer is, well, if you're sick and tired of being sick and tired, do something to make sure you're not sick. But I think people become kind of nonchalant, and inertia is hard. It's hard to make something move after it's been sitting and static for such a long time. I think the other major problem is that we have a dwindling family medicine, force in Canada. Doctors are closing their offices. There's not a great influx of new young doctors wanting to join the primary care team. And so people don't have a primary care provider that's tied to them. Hence the whole concept of moving to, I think, cervical self-swabbing, which hopefully will change access and the rates of screening. So, and I think that there's also a bit of probably lack of confidence in the medical system, maybe a lack of trust. And unless you really have a primary care home, I can see how conflicting messages, the stress of COVID, um, contradictory guidelines, have made people somewhat I don't want to say fearful, but somewhat suspicious of healthcare in general. So I think it's a multifactorial issue, but it's tragic nonetheless.
Definitely. And I think that again just highlights the importance of family medicine, because family medicine is at the front line of all of these issues and really kind of the person patients turn to when they have concerns like this?
Absolutely. And I think that, family medicine, you absolutely need to have vaccine discussions. We're here to provide preventative medicine. I heard a lovely quote that good medicine treats disease, excellent medicine prevents disease. But I think it's also important to emphasize the messages have to be consistent. So, for example, a woman who comes to my office has had an abnormal pap, and I discuss HPV vaccination for her partner, etc. And then she goes to the colposcopy clinic, and the gynecologist also emphasizes the role of HPV vaccines. The repetition, the consistency. I think that that's absolutely essential too. So, family medicine, I think, is maybe the bottom of the pyramid in terms of access, but it has to communicate and it has to be linked to other healthcare silos that the patient's going for. We have a very siloed healthcare system here. It's unfortunate.
Right. But as we've chatted about earlier, working as a team, so important in reinforcing that message. And thank you so much,
Absolutely.
Dr. Palmay. You've shared so many amazing clinical pearls, and we've chatted from everything from HPV self-sampling a little, that's kind of being implemented right now in BC, in certain areas of BC, to chatting more about, cervical cancer, what we can do. And I'm just wondering if there's one takeaway you want listeners to take away from from our meeting today, what clinical pearl would that be?
I think one of the statements that you said, Jenny, HPV vaccination is vaccination against cancer, period. I think that that in itself is the message that we have to consistently repeat. And even still, after so many education campaigns and advocacy, that whole concept hasn't really trickled into public general knowledge.
Definitely. I think that's such a powerful message that we can all share with our patients every day. Thank you so much, Dr. Palme. I really appreciate your time. Thank you so much for sharing your expertise with us.
Thanks, Jenny. Just delighted to speak to you.
Thank you.